And good evening. Thank you so much for watching HealthLine on PBS Fort Wayne. I'm Mark Evans, your host. Thank you for watching, and we invite you to participate in our program this evening. We have a telephone number on your screen as I speak, 866-969-2720. We'll be taking your live calls throughout the program for the next half an hour, and we don't stop down because for commercials because we are public television, you know. All right, so our very special guest tonight, he's been on the show before, but it's been a while, Dr. Tony GiaQuinta, a pediatrician. Great to see you again.
Mark, thanks for having me on.
Absolutely, and we have a very important subject, very relatable, especially this time of the year, and that is vaccines and fighting all these nasty infections you can get during the winter time. So we want to address that. And you are a pediatrician, but you are more than willing, I should say, to answer questions regarding seniors and everybody in between.
Absolutely, bring it on.
Yeah, because vaccines just are not for kids, and not necessarily vaccines, but we're going to talk about RSV, flu, and COVID during the program, which are the three primary things we have to be concerned about this time of the year. So we'll go ahead and get started. I want to know, what does this time of the year, what is it about this time of the year? It makes us more prone to some of these viruses.
Well, it's fall, Mark, and you know, when that temperature starts to drop and those leaves start to turn colors, beautiful for sure, but it does mean that viruses are right around the corner, and this is what we call respiratory season. This is when some of the most dangerous viruses circulate, and they circulate fast, and they are very contagious, and once they wind up in a community, watch out, because if you're not protected, there's a really good chance you're going to wind up with one of these viruses.
Yeah, and fortunately, I didn't get sick enough to go to a doctor because I have had what I'm getting over with right now. I don't know if you can tell by my voice.
You look great.
Well, thank you. I look great. I sound awful, but I look great. But yeah, I was very sick last week, and I finally got over the hump. So luckily, I didn't have to have any medications. In fact, my doctor in the doctor's office recommended I just let it ride out. And if it got worse, of course, to get it checked out and pay some attention to it. So, but anyway, we want to get started here. RSV, especially for infants, and you know, of course, that affects the seniors as well. But has RSV been around, or is this something fairly new like COVID?
Great question. It's been around for years and decades, and who knows how long until they've actually identified it. It stands for the respiratory syncytial virus, RSV, and it's got an annoying, loud name, and it is an annoying, loud virus. And like I said, it is extremely contagious. We've been dealing with RSV as pediatricians forever, and we know, again, as soon as those leaves change colors, it's going to be a long respiratory season, and we're going to be ready again to treat a number of children and young infants with RSV and the deleterious consequences that come with it. RSV is, boy, that is a dangerous virus. It infects about 2/3 of all children before they turn 2. And what's worse than that is it'll hospitalize children. About 2 to 3% of all children that do get RSV will be hospitalized with that virus.
Is the shadow of death possible for the RSV?
Boy, for most children, it is an annoying cough, congestion that is going to last for weeks. Again, a very rare but complication is hospitalization. About 2 to 3% of those children, death is a possibility. We have seen it. It's very rare. But for all of these cases, it is going to really wind up with a weeks of illness. And those hospitalized children are going to be hospitalized for at least 4 or 5 days. And that means a parent that's going to have to take time off work to care for them. So you can see how this adds up over the course of an entire population of Americans, where, boy, we're going to be really struggling to take care of our most vulnerable population once it hits a community.
And it is highly contagious.
Extremely contagious. It lives in what we call droplets, and so any child that rubs their nose and then leaves it on a surface is going to be touched by another child who rubs their nose and leaves it on a surface. So you can see the chain reaction and how it spreads rapidly like wildfire through a daycare and then through the home. You know, when I did a pediatric residency in medical school, so I was around a lot of sick kids. It wasn't until I had my own kids who went to daycare that I really started to get sick over and over with RSV and flu and all of these annoying viruses.
Oh, wow. Well, I guess that, and we're going to talk about this fairly new vaccine, Beyfortus. We'll talk about that in just a couple of minutes, but the RSV vaccines that are available this season, that would be one of them, the Beyfortus, and what else is there?
Well, there's Beyfortus, there is a vaccine called Abrysvo for pregnant moms, and then there's another RSV vaccine for the elderly. And again, boy, you can see the smile on my face and you can feel the excitement because for once, and this is the first time in my career, and I've told all of my patients, and other pediatricians agree with me, this is one of the greatest medical advancements that we've had since I've been a pediatrician, because it is preventing probably the most annoying, dangerous viruses that is really affecting children year after year. It's so commonplace, we kind of just know it's coming, and for the first time ever, we might halt RSV in its tracks. And this is a game changer for me as a pediatrician, but more importantly for families and parents of young infants who are most likely going to contract this virus.
Now, and this, of course, is a vaccine. You would take this before you would come down with RSV.
That's right. Yeah. And as a pediatrician, prevention is my game. You know, if I can prevent an illness from happening, boy, that is the greatest treatment in my medicine bag.
Would it help if a pregnant mother, a pregnant woman, take the virus, or I should say take the vaccine? Would that help the baby before it comes along?
Yeah, great question, Mark. So we can now tackle RSV from 3 different layers. Absolutely, a pregnant mom who can get this vaccine after she's 36 weeks pregnant, 2 weeks before delivery, will pass those antibodies along to the baby, and the baby doesn't have to get the medicine at all. For moms that had their babies like over the summer and their child is under 8 months old, they can also get this antibody treatment where with one shot, antibodies will be available for the baby to protect it against RSV, preventing hospitalization by about 70%. This is a game changer.
Yeah.
Never before could we get antibodies to last for an entire season. So with just one poke, a child can be protected, and this is a big deal. And one point of clarification, Mark, vaccines are, again, as a pediatrician, prevention is my jam. And vaccines are really important. They are safe, they are effective. This medicine is not technically a vaccine. It's an antibody treatment. This is new. So with one poke, the antibodies that fight off the viruses will prevent that. We call that passive immunity, which is a really novel form of treatment.
Okay, well, and how long, when we were talking about the Beyfortus, am I pronouncing that correctly?
You're doing great.
Okay. Have they been working on this for a while?
Yeah, this has been in the pipeline for a long time. So everybody really gets nervous, when a new medicine comes out. But this medicine has been studied for, over 7-8 years, and the safety is just off the charts with this. Probably about maybe 1% will have an adverse reaction to the Beyfortus, and 99% of those reactions are very mild, redness, around where the shot went in. So it is a very safe and, like I said, a very effective vaccine that's been studied very at length in a lot of children.
Now, is that something that a parent or even a senior citizen should ask about when they go see their doctor?
Oh, please, yeah. Whenever we have a new medicine, we expect a lot of questions, and that's what we're here for. Because, frankly, as a medical provider, it's my job to make sure that these medicines that we're giving are safe and effective, because it's my name on the line. So we're going to be looking at these very closely as well, and I have my full seal of approval that this medicine is safe, and it's going to really keep a lot of infants healthy and save a lot of headaches and sleepless nights for parents.
I can tell that you're very passionate and very happy about this.
I am. Yeah, a lot of people will ask me, would you recommend it for your own children? Well, my children are 9 and 11, but I do have 2 young nephews that were just born, and I recommended it for both of them, and they've both received the medicine.
There's no effects, any type of negative effects of getting these vaccines?
Yeah, like I said, they're very mild in nature. That's really just kind of local irritation might be the most severe, but most, 99%, won't have any reactions at all.
All right. Well, just to break here for a second and let our viewers know, in case they just tuned in, we're talking to Dr. Tony GiaQuinta, a pediatrician, and we're talking about vaccines for winter. whether you're if you're a child or an older person, please give us a call. I don't know if the younger kids are going to be able to call us or not, but definitely grandparents, parents, please give us calls. And this could also affect you, not only your children. So the number is on your screen. It's 866-969-2720. So we'll get back to RSV, I'm sure, later in the conversation, but we're going to go to the next one, which is flu. Everybody knows what the flu is. Everybody, I think, probably to my knowledge, has had the flu at one time or another, one degree or another. And flu's been around for a long, long time. In fact, the turn of the century, back in the early 1900s, there was a flu epidemic, and I think it became a pandemic to a certain degree.
Yeah, that's right. It's the Spanish flu, and it killed millions and millions. It was a global pandemic. I mean, it really kind of put COVID to shame at the time when you think about them in perspective with each other. And gosh, we still have big outbreaks of flu that are extremely dangerous. When I was in residency, that was the H1N1 virus, remember? And that flu was a killer. It was a killer. I remember starting residency and being in the emergency room and seeing children die from influenza, and that really imprinted on me that flu isn't something that you just kind of ho-hum wave off. This is something that impacts thousands and thousands of children every year, and it kills thousands every year.
In fact, yeah, there's a commercial on TV, and I don't even know the name of it, and I can't say it because we are a public television, if I did know it, but it's the wolf in the sheep's clothing, the sheep's outfit, and, I'm the flu, and I'm not going to, trying to downplay the effects and so forth, but it really is a very effective commercial because it seems like people kind of pass it off like it's, so I'll get the flu, I'll get over it. But what is the determining factor whether or not you're going to be really sick with the flu versus just have a touch of it? I mean, what degree can people get this?
Yeah, it's a great question because everybody's going to react differently to viruses. And the truth is, we really don't know which children or adults might be impacted more and might have more serious morbidity and mortality when you get one of these viruses. When I was a resident at the Children's Hospital, I had healthy 16-year-olds need to be on aggressive respiratory support because of influenza. Some even, unfortunately, died because of it. And when you see that, when you know that, boy, any amount of prevention is going to help. And listen, even if you're feeling very confident and you feel like you're not going to get sick from flu to the degree of hospitalization, remember too, this is a service that we're doing for each other. If you have compassion and love for your community and for each other, vaccinating yourself is a really wonderful gesture that you can do for your brother, your neighbor, your loved ones to help prevent them, to help prevent the community from spreading these dangerous viruses and causing swell-ups of hospital beds requiring aggressive treatment for these viruses that many times can be prevented.
And how is the flu transmitted?
Flu is transmitted usually through respiratory particles. So if you're in a room and you're coughing and a respiratory particle exits your mouth, then there's a good chance that that particle goes through the air and it goes through your mucosal surfaces and infects you.
Well, that's pretty much the same way as RSV?
Yeah, RSV is a little bit more annoying because it lasts on surfaces even longer. So there again, that's how those kids will pick it up on their hands, rub their nose, and pass it along to somebody else.
I see. And what about COVID regarding this conversation?
Yeah, COVID is, again, that's one of these respiratory droplets where hopefully if we mask up and wash our hands a lot, we're going to prevent a lot of that disease. And frankly, we were quite effective at doing that. When our schools had to mask up and be aggressive at preventing COVID, they were able to keep their doors open. They did an amazing job of that, which, by the way, we saw practically zero RSV admissions that year or influenza admissions. It wiped out all of them. So yes, you can protect yourselves with using masks and washing your hands and being aggressive, just like a lot of viruses.
All right. We do have a call coming in. It's from Steve. He prefers to be off the air, and that's fine. We'll put your voice on the air, or we'll just read your question. He's asking, how does the flu vaccine affect an individual's natural immune system?
This is a great question. I actually get this question a lot. And the fact is that vaccines work with your natural immune system. So the analogy that I like to give is, instead of giving the influenza virus to you, we're just giving just a little piece of the influenza virus. If I was a virus, it'd be like taking my toe and injecting it into you so that you can recognize that toe, and so that when that virus comes along, it can see that toe and say, now I'm ready for you, without actually getting the illness. But it's your natural immune system that is reacting to that particle to develop immunity to it. So, a lot of people say, well, it's not natural to get a vaccine. It's absolutely natural. It's just a much safer way to get your immune system to recognize a dangerous foreign pathogen without getting the disease itself. This is fantastic. This is science, and we love it. And again, this is our game. This is the game that we love to play, is when we can get ahead of these illnesses and prevent them instead of having to treat them after the fact.
And there are some people, and I've had this discussion off the air, and in fact just out in public, where people think that if they get a flu shot, it's going to take care of them for a long, long period of time. They don't have to even worry about it next year. But we were talking about RSV. How important is it to get inoculations or vaccines at least once a year for these two?
Well, nobody likes to get that poke in the arm every year, but it is important because the immunity will wane and it will change from year to year. So the truth is, we don't know which influenza variants are going to be circulating every year. We learn a lot from what's going on in the southern hemisphere. Remember, right? They're just finishing up their winter. So the vaccine from this year is about effective, usually around 50-60%. This year, it might be a little bit less, is the data we're seeing. But what I remind everybody is 30%, 40%, 50%, whatever is better than zero.
Oh, yeah.
And if we can have any little chance to prevent an illness and do it safely and as effective as possible, sign me up.
All right. Well, that's sign me up too. In fact, my insurance company is not hassling me. I won't say that, but I get emails and I get texts almost every day.
They would much rather pay for you to get the vaccine than to pay for your hospitalization. Yeah. And guess what? So would we all. This is what drives up healthcare prices, and it's a headache for everybody. So yeah, let's do everybody a favor, get our flu shots, and let's drive healthcare prices down and keep us all healthy.
Well, and we were talking about, we kind of lightly touched on strains. I mean, there's not one particular strain of RSV or the flu. I mean, can you give me any type of numbers, how many different types of strains that we can possibly be dealing with? Yeah,
we use these antigens on the flus to kind of determine and label them. They're called H and N antigens. And so H1N1 was one variant, and there's a lot of different numbers. So flu's a really tricky one. It's a little bit of a guessing game where our epidemiologists, the people that really study, how these viruses circulate, they're kind of guessing which concoction to come up with when they give you that flu shot. Sometimes they do a great job, sometimes not as well. H1N1, they didn't have H1N1 in that flu shot, and you had to get a second poke just to get coverage for that. This was a long time ago, back in 2009, but that was one example where it was just a miss. This year, again, it's going to be protective. Sometimes it's better than others, but boy, it's our best shot, and we should all take it.
Well,
pun intended.
I'm with you there. No, we should. We absolutely. Do we suspect that this winter is going to be worse than any other winters?
We don't know. My hope is that with this RSV vaccine, that we are going to see what we've never seen before, which is where our pediatric units aren't just saturated with infants infected with RSV, and then sometimes doubly infected with influenza and even COVID. We called that the triple pandemic when we took off our masks for the first time in 2021. And then that winter, boy, all of those viruses circulated, which we hadn't seen in a while, and our immune systems just weren't ready for it. And boy, did we see a big surge in a lot of those viruses at weird times too. We saw RSV circulating in the summer, and so again, when we when we try to manipulate things by protecting ourselves with things like masks, it did lead to, boy, a big surge in the months to come. So hopefully every year we protect our infants with this RSV vaccine, and again, game changer for those young moms and dads that have young ones vulnerable to that virus.
And I know just from just keeping my ear to the ground on this medical situation as far as RSV and the flu, those seem to be very much highlighted versus COVID. We're going to be talking about COVID too during our conversation.
Sure.
But it seems to, and I don't mean to demean it or to rank it low, but it seems like it's just not as prevalent as the RSV or the flu. Do we have a pretty good handle on COVID right now?
Well, I think we're all still a little gun shy, right? We all remember the damage that COVID did.
Oh, yes.
Millions of Americans died with that. We know the damage that influenza and RSV can do. Thousands and thousands of healthy, adults will get infected with flu every year, and the same with RSV. So it's hard to rank which one is going to be more dangerous than the other. We're really fortunate right now. COVID hospitalization numbers have been pretty steady, and a lot of that is because our bodies have kind of adapted a little bit, and we've been getting these booster shots for COVID. The last COVID shot came out about a week or two ago to cover the most recent strain. So if you haven't had your COVID booster, here's another opportunity to give yourself a layer of protection.
All right, so babies. Is there a concern for COVID as much as there is for even senior citizens?
Always. We definitely have seen kids get sick with COVID and have dangerous reactions to COVID, like myocarditis, which is something that I definitely saw rarely, but in my clinic. For me, I'm always worried about RSV and flu, and then COVID is something too that's fresh in my mind.
And it's okay to get double shots, or you can do triple shots, right?
Absolutely, yeah. In fact, all of these vaccines work in a little different way, and there's no problem at all in getting these vaccines at the same time.
All right. Would you recommend that as a doctor?
Oh, again, prevention, if it's safe and well studied, yes, I'm in. And these vaccines have been well studied, and I feel very confident that they are safe.
So it's not really necessary to go in and get your COVID shot today, and then maybe next week get your flu shot, and then after that maybe get your RSV. You can get them all three and not worry about it.
Oh, for me, give them all at once. I don't want to get a poke every time and get nervous every time. Yeah. And I don't want to go to a doctor's office and take up their time. And as well as, when you're at a doctor's office, guess where the sick people are? So,
right.
Yeah, if we can do this all at once, yeah, sign me up.
That's one of the reasons why they didn't want me to come in when I end up getting this.
I bet.
But thankfully. Let's talk about some symptoms. We've only got about 3 minutes left in the program. What delineates each one of these as far as the symptoms go? RSV, flu, and COVID.
Yeah, there's a lot of our overlap. I know RSV is coming because it is a congested kid that is having trouble breathing. They have so much snot in their nose that they can barely take their bottles to drink because they're trying to swallow through their mouth and their noses are clogged. And they just can't swallow and breathe at the same time. And these kids have a cough again that just won't quit. They're up all night coughing, and guess what? The parents are going to be up all night too, trying to be worried and taking care of their infant. That cough is going to last for 2 weeks. And the worst thing about RSV is there is no medicine for it. Okay, the only treatment for for RSV is what I call vitamin T, which is time. That and support with hydration, sometimes a little bit of oxygen, IV fluids, but really there aren't medicines that's going to help treat this like we do at most of our diseases. It's just time and waiting it out, and boy, is that frustrating.
Well, it is, and it's almost like when you have a common cold. You got to just let it ride itself out. Now, are there possibilities down the road to come up with treatments for the RSV?
We've been trying for years and years and years, and we've been ineffective. It's really unsettling that, with all of our advancements, we still don't have a treatment for RSV. But now we have prevention, and this is, again, such a game changer. I'm so excited. You're going to see me with a little extra skip in my step when you see me, because for the first time ever, we can prevent RSV.
I really am glad that we're talking about this. Now, the flu, many people have had the flu, kind of sort of the same symptoms, but sometimes it affects your gastronomical system. Is that correct?
Yeah, it's a systemic illness, and by systemic, I mean it's going to affect everything. You're going to have the headache, you're going to have the fevers, the body aches, and certainly the respiratory symptoms as well. Flu pneumonia is very common, and it can even affect your GI system as well. So, yeah, the whole thing can be affected by influenza, and man, it can really, you're going to feel terrible when you have influenza.
Well, and it sounds to me like RSV and COVID symptoms are very similar. Am I wrong?
It's hard to say. You know, babies, when they get COVID, it feels just like, another cold, most of the time. And then at the same time, you have some children that get COVID and have these terrible multi-systemic symptoms like carditis and fevers for 4 or 5 days. It's a very weird virus, and it's one that we had a tough time grappling with.
All right. Dr. GiaQuinta, we have about 20 seconds left. Any take-home notes for our viewers at this moment?
My take-home is if you have a loved one that is eligible for this new RSV treatment, please encourage your loved one to get it. You'll be saving me and my office staff a lot of headaches and a lot of and really helping these young families with their vulnerable infants as well.
Well, thank you for sharing that at a very critical time of the year. That's a very good topic to have. Dr. Tony GiaQuinta, pediatrician, and we'll have him back again very, very soon. In the meantime, thank you for watching. Thank you for your calls. Until next time, good night and good health.
The preceding program on PBS Fort Wayne was made possible in part by
Momentum, progress, innovation. Parkview Health knows standing still isn't an option. We must learn, grow, excel, and actively work to advance healthcare for our community and beyond. With technologies that improve access to care and teams of specialized providers, we are moving healthcare forward. Right here at Parkview Health.